Hello, and welcome to the continuing series of lectures in the series that is designed to help prepare you for taking your national licensing examination in veterinary and prepare for your veterinary boards. My name is Dr. Tom Vickroy, and the subject of my lecture today is going to be a review of some basic principles related to the use of drugs or pharmacology in companion animals. Now, as you may well realize, covering a discipline such as pharmacology in an hour or thereabouts long lecture is not a terribly feasible thing to do. So what I've decided to do today is to focus on several classes of drugs that I think are extremely useful, used widely in both small and large animal species, and to cover these drugs in a bit of detail, at least, that might help prepare you for a series of questions which could readily show up on your board examination. After some consideration of this matter, I decided that probably the best approach would be to focus on two broad classes of drugs that are used both in large and small animal species. And the two classes of drugs that I'm going to be reviewing today for you are the antibiotic agents that are used widely now in many of our companion animals, as well as a series of groups of agents that are used for treating or alleviating pain in our companion animals. And if I could have the next slide, please. The antibiotic agents that I will talk about today I will focus on the basic pharmacological properties of these drugs. We're going to be dealing with their mechanisms of action, side effects, major species indications, contraindications, and in the latter half of this topic, I hope to cover at least some of the major groups of drugs that are going to be used or are commonly used for alleviating pain or preventing pain in our companion animals. And as you can see here, this consists of 5 major classes of drugs that I would like to cover during this time. The first 3 there listed on this slide, the opioid analgesics, the alpha-2 adrenergic agents, and the dissociative anesthetics, which the prototype is ketamine, are all classes of compounds that act within the central nervous system to control pain in an animal. The latter 2, the local anesthetics and the non-steroidal anti-inflammatory drugs, are classes of agents that are commonly used to alleviate or treat or prevent certain forms of pain, but do so by actions outside the brain or central nervous system. And so we'll talk a bit about their actions also. Now, to begin with, the antibiotics. Some of the considerations one must go through before using an antibiotic are listed here, and this is certainly something which you must consider every time you're using an antibiotic agent. Certainly the nature of the pathogen, the organism that the animal may be infected with is an important consideration. Proper selection of an antibiotic based on that animal's concurrent diseases, whether the animal has liver or kidney disease, are important considerations in choosing an antibiotic, as well as choosing an appropriate dosing regimen, and also based on the type of supportive therapy with other drugs that may be used in that animal. All of these factors come into play in determining what antibiotic agent one may use in treating an animal. We're not going to necessarily consider all of these factors today because the focus here is really to cover some of the basic pharmacological properties of the antibiotic drugs, but nevertheless it's important to keep these other aspects in mind. Now, another important feature or important principle or concept to keep in mind when dealing with the antibiotic agents is the concept shown on this slide, which is that of the chemotherapeutic triangle. And the basic premise of this is that when using an antibiotic agent, one is using it not only to try to affect a microorganism which has invaded an animal's body and which the drug is being used to treat it and hopefully render that organism no longer viable, but the drug is also going to have an effect on the host animal itself. This is not a desired action of these drugs, but nevertheless it's one that we must deal with, one we must consider the adverse side effects that these agents may produce in our host animal, and this often leads to a choice of a particular antibiotic agent over another in basic chemotherapy. Now, some other factors that come into play also with choosing an antibiotic agent are shown here on this side. Certainly the status of the animal itself, whether it has some other ongoing pathology, as I mentioned previously, renal disease, liver disease. These can be important factors in determining whether or not one chooses one particular antibiotic over another, because these can be important, these organs can be very important for proper elimination of the antibiotic from the animal itself. The toxicity to the animal, as you are well aware, there are many antibiotics that are well tolerated by some species but not others, and so that can also factor into your selection of an antibiotic drug. Interactions with other drugs can be very important, certainly, because of the concurrent use frequently of many other drugs along with antibiotic agents. Government regulations are an ever important and increasing area of concern because of residues, drug residues, in our food supply, and the tight regulation of that has led to restricted use of many of the antibiotic agents in food animals. Certainly other pharmacokinetic factors, such as the necessary drug level you must have in order to properly treat an organism, whether that organism is resistant to a particular drug, come into play in your choice of an antibiotic. And finally, other considerations related to the type of organism that an animal may be infected with, the species of that animal, the environment it is in, the nature of the infection, the location of the infection in the animal's body, whether we're talking about organ systems such as the respiratory tract, a cutaneous infection, some deep tissue infection, all come into play in terms of trying to determine what type of antibiotic agent may be best in treating a particular animal. So all of these factors are important, but we're not going to be talking about them any further today, because I really do want to focus on the basic pharmacological properties of at least the major classes of antibiotic agents that are used in our companion animals. Now, a common subclassification that's used for our antibiotic agents is shown here, and that is whether or not an agent is bacteriostatic or bactericidal. Bacteriostatic agents are those shown here that do not kill an organism, but generally arrest or stop its growth. Bactericidal agents are agents which can outright, in and of their own abilities, kill microorganisms. And I've subdivided the two groups here into those areas, into those types of antibiotic agents for you to review. And these groups of drugs are ones that we will be covering here today, at least the majority of these. Now, if we look at the bacteriostatic agents and what are some of the advantages and differences between these from the bactericidal agents? Bacteriostatic agents generally have a slower onset. They generally require a good host immune response because they are not going to be useful in killing these agents. They're merely arresting their growth. So generally we are not going to be using these agents in animals that are immunocompromised in any way. And additionally, these agents, one needs to be aware of which agents are bacteriostatic or cidal simply because it is therapeutically disadvantageous to combine two classes of bactericidal agents with one, or bacteriostatic agents with one another, and certainly it's very much contraindicated to combine bacteriostatic agents with bactericidal drugs, as they can antagonize the actions of one another. So knowing the classifications of these drugs, being able to identify them as bacteriostatic or cidal is very important. Now, on the other side, the bacteriostatic drugs, or bactericidal agents, are the ones that can outright kill organisms by themselves. These generally have a faster onset, so these drugs would generally be chosen in cases where an animal has experienced a much more advanced stage of an infection, and thereby can is in need of antibiotic therapy to be effective much more quickly. Generally, these agents are the drug of choice, or classes of within here are the drug of choice for dealing with animals that are immunocompromised, and you will frequently encounter combinations of two bactericidal agents being used together to generate a more advanced or more efficacious killing of microorganisms or polymicrobial infections if you encounter situations such as that. So with that brief preamble, let's look at some of the major classes of the antibiotic drugs. Antibiotics generally can be lumped into having one of three types of mechanisms of action. The so-called cell wall synthesis inhibitors are a major group of drugs. The drugs that interfere with DNA metabolism within microorganisms are a second major class of antibiotic agents. And finally, drugs that can interfere with protein synthesis, whether they do that reversibly or irreversibly within microorganisms, are a third major class. In all of these cases, the antibiotic agents are effective against the microorganism and not against the host animal cells by virtue of the ability of these agents to selectively interfere with a process that's somehow unique or different within the microorganism. And that's the basis for their selective toxicity. If we look at agents that are well recognized as cell wall synthesis inhibitors, the two at the top of this list are certainly ones that you're all very well familiar with, the penicillins and the cephalosporins. These agents are sometimes referred to as beta-lactam antibiotics, and we'll discuss in a minute why that is the case. But these represent certainly an important part of the veterinarian's armamentarium against microorganism infections in our companion animals. The next group of drugs, the protein synthesis inhibitors, again, you'll notice here several groups of very commonly used antibiotic agents, the aminoglycosides, the macrolide antibiotics, which include agents such as erythromycin. All of these drugs, the tetracyclines, chloramphenicol, these are all agents that interfere with protein synthesis in microorganisms. Finally, the class of drugs that interfere with DNA metabolism in microorganisms represents a third major and important group of antibiotic agents. The sulfonamides and the potentiated sulfonamides are two very old class of agents that are still used widely, though, which act through this mechanism. And a newer class that we'll talk about at the end, the fluoroquinolones, are certainly a very important group of drugs that are used in our companion animals, but also a group of drugs which has increasingly come under scrutiny by the federal government, trying to limit the use of these agents in our companion animals because of the concern over resistance to these antibiotic agents and how that may be transferred to human pathogens, for which these agents are also very important and very effective. Now, let's start off with the cell wall synthesis inhibitors. The penicillins and the cephalosporins are two groups of drugs that are included in this class. These are referred to as beta-lactam antibiotics, and I realize that probably this diagram here is a bit small for you to read, but the red circle here in the middle of this diagram shows the structure within these groups of antibiotics that is called a beta-lactam ring, and that's the nature of where this name derives from. Now, the importance of this beta-lactam ring really derives from one very prominent mechanism by which microorganisms develop resistance to these drugs, and that is by the synthesis and formation of large quantities of an enzyme or family of enzymes referred to as beta-lactamases that are able to break this ring and lead to those organisms developing resistance to this class of antibiotics. So this can be a very important mechanism by which these drugs lose their effectiveness in a variety of microorganisms. Now, the cell wall synthesis inhibitors bind to and prevent cross-linking of the network of peptidoglycans within the cell wall of microorganisms, and that is the basis for their action. Now, as indicated on this figure, which is probably, again, a little too small for you to see off of your video presentation, these agents bind to penicillin binding proteins in the cell membrane, which then those proteins are very important for the synthesis of this network within the cell wall. When they bind to these proteins, the cell wall cannot be formed and repaired adequately, and that leads to the death of these microorganisms. Now, that's true for gram-positive cells, which tend to generally have a very thick cell wall and rely very heavily on that mechanism for maintaining the integrity of the organism. On the other hand, gram-negative organisms tend to have frequently an impenetrable outer membrane, which limits the utility of the penicillins and cephalosporins, at least certain classes of them, because of their inability to gain access to the penicillin binding proteins where they must work on these organisms. So generally, at least with the older penicillins and even the first generation cephalosporins, those agents generally were more effective against the gram-positive organisms. Penicillins are divided broadly into 5 classes of agents. I've listed those here. I don't think this is terribly important for you to know as in terms of your board preparation. Probably the most important point to point out about these classifications of the natural penicillins, the beta-lactamase resistant agents, the aminopenicillins, the extended agents, and the augmented agents. 2 points to note. One, the aminopenicillins, which most of the agents within this class begin with AM, like amino, amoxicillin, ampicillin. These agents, the aminopenicillins, generally have much more substantial gastrointestinal side effects than do the other classes of agents. The other point to note are with regard to the augmented agents. These are a combination of 2 drugs, which are include a penicillin with a substance, in this case, in this example listed here, amoxicillin with clavulinate. Clavulinic acid is a substance that can inhibit beta-lactamase and so prevent microorganisms from breaking down the penicillin agent. And these are also much more advantageous. Now, certainly within the penicillins, there's a wide variety of these agents available. One that you should certainly take special note about is a salt form of penicillin called procaine penicillin, which has a very extended duration of action and is particularly noteworthy in a number of species to be careful in the use of this agent because of its extended duration of action. It has a very long withdrawal time in food animals, and it is also an agent that causes some untoward effects in equines, particularly can be quite a stimulant to these animals. So with that in mind, let's move on to some of the potential problems, pharmacokinetic, pharmacodynamic actions of these drugs in the animal itself. One important consideration with the penicillin certainly is how these agents are eliminated from an animal's body. The primary mechanism for many of the penicillins is through renal or kidney excretion of the drugs. Now, the penicillins being acidic drugs, and many drugs that we use in our companion animals that are acidic drugs, the penicillins are cleared by the kidney through 2 mechanisms. One that involves glomerular filtration, and the other that involves, as indicated by this star flashing here, is a renal tubular acid transporter mechanism. The renal tubular acid transporter is a mechanism that is involved in the elimination of many other classes of acidic drugs in animals, and so this provides a primary mechanism for drugs to interact with and cause interactions with the penicillins by eliminating or reducing their elimination from the animal. Excuse me, I'm still fighting a cold. The penicillins are also, in addition to the clearance, Two other important points you should probably keep in mind about them is these agents generally do not get into the central nervous system, so they're not used for central nervous system infections. And in fact, they can cause seizures in animals when they do penetrate into the central nervous system. So that's an important consideration about them. And finally, they're also highly protein-bound drugs. Many of them are extremely highly bound to plasma proteins. That leads to their another form of interaction with other drugs that are highly protein-bound. Penicillins, generally as a class, are considered a fairly safe group of agents. The major concern with these is hypersensitivity reactions in animals that do develop hypersensitivities to penicillins. This can be quite a life-threatening reaction, and so it's something that you need to be aware of and certainly avoid in using these drugs. They also can, and this is certainly a property of all the penicillins and all antibiotics in general, can cause GI disturbances. The aminopenicillins are, as mentioned previously, the worst in this case. We have mentioned previously this interaction with plasma protein binding that can occur with other classes of drugs, and I've just listed here some of the other classes of drugs that this can occur with. Phenylbutazone, a non-steroidal anti-inflammatory drug, salicylates, the barbiturates, and also sulfonamide antibiotics. These are all classes of drugs that bind to the same proteins that the penicillins do, and they can compete with one another for binding to those proteins and affect each other's pharmacokinetics. I've listed here some preparations and formulations of the penicillins that are fairly commonly found and used, and these are not anything particularly noteworthy about these, except the ones below the line here generally would be considered more broad-spectrum agents, and that includes the potentiated penicillin combination here of amoxicillin plus clavulanic acid. That's a fairly broad-spectrum agent. Okay, the other group of the cell wall synthesis inhibitors are the cephalosporins. This is a newer group of antibiotics, but nevertheless sharing a common mechanism of action with the penicillins, that being cell wall synthesis inhibition. The cephalosporins are commonly divided according to the organs in which they are most preferentially active. And so one common breakdown on this group of drugs is shown here, where I've listed 5 different subgroups of the cephalosporins. The orally active agents are commonly used for infections in skin and urinary tract, and then there are a variety of parenteral agents, the group 1 through group 4, which have different indications therapeutically in and of themselves. These subdivisions, though, you should not by any way be misled. They all are agents that still share a common mechanism of action and generally share similar adverse effects also across these classes of the various cephalosporins. Now, the properties of the cephalosporins are extremely similar to the penicillins. And in fact, it's better to really think about what are the differences. Probably the biggest difference between these two classes of drugs is that cephalosporins in general tend to not be as highly bound to plasma proteins. And so they're less likely to interact with other types of drugs such as the sulfonamides or the barbiturates, which are more commonly become a problem with penicillin therapy. They are, as a group, fairly non-toxic agents. One that is of particular note is this agent, cephaloridine, which has been noted to have quite problematic occurrences in cats, and its use in cats has been contraindicated for that reason. I've listed here a number of the cephalosporins that are available and commonly used in practice today. Probably one that is noteworthy here is ceftiofur, which is one of the few cephalosporins that is used and approved in food animals. Again, remember that with many of these antibiotic agents, food animal use of these drugs is of great concern, and there are fewer and fewer agents being approved for use in food animals, and withdrawal times are being strictly enforced with these agents. So it's certainly an area of concern with these drugs. Okay, so that concludes an overview of the cell wall synthesis inhibitor antibiotics. As far as the protein synthesis inhibitors, we have several major classes of these that are used. The aminoglycosides, the tetracyclines, macrolides, these are all drugs that inhibit protein synthesis through similar but slightly different mechanisms in microorganisms that are sensitive to these drugs. The aminoglycosides are the only group within this class of drugs, that is the protein synthesis inhibitors, that are considered bactericidal. All of the other agents are bacteriostatic drugs. So that's an important distinction, certainly, for the aminoglycosides within this group. They are the only bactericidal agents. The aminoglycosides are a group of protein synthesis inhibitors. One fairly unique feature about the aminoglycosides is that these drugs require active transport to get into sensitive microorganisms. As a result of that, these drugs are ineffective against virtually all anaerobic organisms, because aerobic organisms are the only ones capable of transporting these antibiotics into the organism where they can be effective as inhibitors of the protein synthesis. Generally, the aminoglycosides are only administered parenterally because they are not absorbed when given orally. They don't distribute widely throughout the body. They certainly don't get into the central nervous system well at all, so they're not used for any type of CNS infections, as I mentioned previously for the penicillins. And the action in which, the mechanism by which these drugs act is also somewhat unique in that these are listed as what is known as concentration-dependent killing antibiotics. That is, the action of these drugs is dependent clearly on the concentration of the drug rather than the time at which or the duration of which it's present in the body. And this has led to an adjustment in the use of these drugs as far as the intervals at which they are administered. You now see aminoglycosides being administered far less frequently than had been used previously as recently as 10 years ago. So these are important. It's certainly an important use or concern about the use of these agents. The aminoglycosides, major toxicities that you need to be concerned about with these drugs, or certainly keep in mind, is that they are toxic, can be toxic to the kidney and also to the hair cells of the inner ear. And so this can lead to irreversible nephrotoxicity and loss of hearing in an animal if these agents are given for a prolonged period of time. So that is certainly a concern for using these drugs. Indications of nephrotoxicity are listed here. Some of the signs that are clinical findings you may see that would lead you to believe that nephrotoxicity is occurring. Certainly increase in protein levels in proteinuria is certainly one indication that this is a potential problem that's already occurred with the use of these drugs. The aminoglycosides, in addition to their toxicity on the kidney, one other major concern with these is that these agents can cause outright muscle relaxation. They can certainly enhance or potentiate the actions of muscle relaxant drugs. So this can sometimes, on rare occasions, lead to paralysis in animals when given an aminoglycoside antibiotic. Here's an example of the change in the way in which these drugs are now used as far as the frequency of dosing with them. Most of these agents now are given once daily rather than multiple times daily. And the purpose for this is, and I don't know if this will be visible to you or not, but the purpose for this is to allow drug levels in the plasma to fall below a certain critical value, which for a period of time during the therapy, so that below this critical value, which is indicated by this dotted line here, this leads to a reduction in the toxicity of these drugs, particularly the nephrotoxicity diminishes. So The older method for giving these drugs was a lower dose, repeated administration, as shown here in the blue line. That is no longer considered a feasible way of using these drugs. So now you see the drugs, aminoglycosides, being administered at higher doses but less frequently to avoid toxicity. And here are some common aminoglycosides that are used in our companion animals. Amikacin is one that's very widely used. You'll notice that streptomycin is one that I've deleted from this list. It is an agent which has now been largely removed from the market for veterinary use because of its use in humans, or its need for use in humans. And this is certainly an ongoing problem with many of the antibiotic drugs. Okay, next group of protein synthesis inhibitors is an older group, the tetracyclines. This is a group of bacteriostatic agents. They're reversible inhibitors of protein synthesis. These also must gain access into the organism by active transport, as was the case with the aminoglycosides. These agents, unlike the aminoglycosides, though, are fairly reasonably well absorbed orally, and so they're often given that way. And they are primarily eliminated by the kidney. Doxycycline is a very noteworthy example, or exception to this, though, within the group of tetracyclines. It is a drug that relies primarily on liver or hepatic metabolism for its elimination from the animal. This can be important, certainly. If you are treating an animal for an infection, you need to use a tetracycline, and the animal has severe or moderate renal dysfunction. This would be a case where you might choose an agent like doxycycline in these animals. Unfortunately, bacterial resistance to these drugs, this class of drugs, is fairly widespread in the U.S. and has markedly limited their use. The toxicities associated with tetracyclines, more general ones here, certainly GI upset, and then some very specific ones that are noteworthy with regard to the tetracycline. Certainly these agents have been associated with a fair incidence of cardiac arrhythmias. They are well known to make animals and humans more sensitive to sunlight, and so there's the possibility of damage to skin that isn't properly covered by fur or hair. In sensitive areas of the body, animals can receive quite a bit of damage from direct sunlight when they're being treated with a tetracycline. And more of an aesthetic problem, but nevertheless a concern in show animals or in young animals is that these agents are often deposited in the growing enamel of teeth and can lead to a discoloration of them. Here are a couple of the agents that are common to this class, doxycycline being noteworthy for its use for treatment of canine ehrlichiosis. It is extremely effective in that regard, and again, it's noteworthy because it's the agent within this group that is metabolized primarily by the kidney. Okay, the third group of antibiotics that are well known for acting by inhibiting protein synthesis are the macrolides. These, like the tetracyclines, are bacteriostatic drugs. The macrolides are very lipid-soluble compounds. That is, they are able to get into cells very effectively, and as a result, they're very effective at treating a variety of organisms that are primarily intracellular in location. They distribute very well throughout the body because of this high lipid solubility, but they generally do not get into the brain or CNS very well. So again, CNS is very protective against the entry of a wide variety of the antibiotic drugs. The side effects of these drugs are primarily gastrointestinal in nature, and this can be quite problematic, particularly in horses, which can be extremely sensitive to some of these agents and develop a very severe colitis as a result of treatment with macrolide antibiotics. The three that I've listed here as examples of the macrolides, erythromycin, tylosin, and tilmycin, are all very effective agents. Tilmycin is maybe unique within this class in that it is particularly effective at achieving high levels in the respiratory tract, in lung tissue, and thereby making it effective for treating upper and lower respiratory tract infections. The next, and I believe last agent within the protein synthesis inhibitors is chloramphenicol. Chloramphenicol is a bacteriostatic drug, a reversible protein synthesis inhibitor. It is extremely good at distributing throughout the body, gets into virtually all body tissues, crosses the placenta in pregnant animals, gets into the central nervous system fairly well. So it is a very useful drug in that regard because of its widespread distribution. It is noteworthy for a couple of reasons. One is that its half-life is markedly different across the various species, and that can lead to certainly a difference in the use of this agent. And it is also noteworthy in that it can be very toxic to animals and lead to severe GI upset, as well as inhibit the metabolism of other drugs. The other very noteworthy thing about chloramphenicol is that it can cause an irreversible bone marrow suppression in humans. It can cause bone marrow suppression in virtually all species, but because this can be irreversible and fatal in humans, this drug is absolutely contraindicated ever for use in a food animal. And it is something that you should certainly be aware of and never encounter or consider using this drug in a food animal. Okay, so that covers the two of the three major classes of antibiotics. The third class being those that act by interfering with DNA formation or synthesis or replication in sensitive microorganisms. And there are two classes I'd like to talk about here. First being the sulfonamides and the sister group, the potentiated sulfonamides, and the second group being the fluoroquinolones, which are a newer group of antibiotics that are very widely effective, although they have some limited uses in veterinary medicine because of the concern of development of resistance to these agents, which are extremely widely used in humans. The sulfonamides. This is an old group of agents that was designed with a specific purpose in mind. These agents were first identified as having the ability to interfere with folate metabolism in bacteria. By virtue of interfering with folate metabolism, these agents are able to prevent the synthesis of DNA, since DNA requires folates to form pyrimidines and purine bases for DNA synthesis. The interference with DNA with this pathway is an important mechanism for how these drugs work. And as shown here at the bottom, this is just a linear representation of the synthetic pathway for folates in microorganisms. Paraminobenzoic acid is converted to dihydroteric acid by this enzyme, and the sulfonamides inhibit the first enzyme in this step and essentially eliminate the formation of DNA as a result of that. Now, sometimes organisms are able to circumvent this pathway by resistance, developing different forms of this enzyme that the sulfonamides are not effective against, and that can lead to resistance to this group of drugs. The sulfonamides are broadly subdivided into 4 groups. All of them are acidic drugs, though, so they can certainly interfere with some of the pharmacokinetic properties of the other antibiotics, such as the penicillins, which are also acidic agents. The 4 groups that I've listed here are basically broken down more on the solubility of these agents, which leads to somewhat the tissue indications for their use. So the standard agents are often used for systemic infections, versus the poorly water-soluble agents are often used topically for cutaneous infections, or can be given orally for GI infections where they can act locally within the GI tract. The potentiated agents are the fourth class of the sulfonamides, and these are actually represented by a combination of two drugs, as shown here. The potentiated sulfonamides represent a combination of a sulfonamide with a second drug which inhibits a separate step within the folate metabolic pathway. As shown here, in this multi-step pathway, which eventually leads to the formation of pyrimidines and purines for DNA synthesis, the potentiated sulfonamides interfere with two steps. The first step, which was referred to before, as well as the second step. As a result of this sequential blockade of folate metabolism, these agents can be much more effective than the regular sulfonamide drugs, and as a result, they are also bactericidal in most organisms that are sensitive to these agents. Now, the major concerns with the sulfonamides, adverse reactions, generally these are not terribly toxic class of drugs as a whole. They can certainly cause localized tissue irritation with administration of them. And in some isolated cases or more restricted cases, they can lead to abnormalities in various blood cells. Hypersensitivity reactions have been reported, as they have been for the penicillins, and immunosuppression is a problem that has been noted in a selected group of animal species or breeds. In this case, Doberman pinschers are noteworthy for developing immunological problems with sulfonamide therapy. The drug interactions with sulfonamides that are noteworthy, certainly these being acidic drugs which are highly excreted by the kidney, these drugs can interfere with the tubular secretion of other classes of acidic drugs, such as the penicillins, the barbiturates being another class of drugs, that these will lead to a reduction in their elimination through the kidney. These drugs are also, the action of the sulfonamides are interfered with by the local anesthetic procaine, which is metabolized to form para-aminobenzoic acid, so that can be a noteworthy drug interaction. And finally, when these agents are given orally, they require an acidic environment, so if you have concurrent therapy with an antacid, that can lead to reduced absorption of these drugs. Last group of antibiotics, the fluoroquinolones. The fluoroquinolones are a newly developed group of drugs, have been in the veterinary market the shortest of any of the classes that I've talked about so far. They have a unique mechanism of action. They interfere with DNA metabolism, but they do so by a unique mechanism, and that's shown here in the yellow box. All single-celled organisms require an enzyme that's known as DNA gyrase to supercoil DNA from its linear form, linear circular form, into the supercoiled form in order to be used for transcription and translation. The fluoroquinolones inhibit this enzyme, DNA gyrase, thus preventing this reaction and killing the microorganism because it's no longer able to replicate its DNA. And that's their basic mechanism of action. Now, the fluoroquinolones as a group are relatively have a relatively limited use time yet in veterinary circles, so they are not terribly well characterized as far as their pharmacokinetics and pharmacodynamics. Certainly we know that these drugs are well absorbed orally. They appear to be relatively safe. The two major concerns that are noted certainly with regard to the fluoroquinolones are their use in young animals because of the potential for damage to cartilage, certainly in weight-bearing joints, and so these agents are also contraindicated or carefully used in pregnant animals as a result of potential damage they could cause to the fetus. And one more recent concern with these agents, and this is particularly true for enrofloxacin, is that these agents, at least at high doses, can cause an irreversible retinopathy in cats. And that's been a more recent observation about these drugs. Drug interactions that occur with the fluoroquinolones, these are mainly the two listed here. Antacids tend to reduce the absorption of these drugs given orally, and the non-steroidal anti-inflammatory drugs in combination with fluoroquinolones, particularly in cats, this has been reported, can cause seizures. I've listed two drugs here that are commonly used within this group. Enrofloxacin or Baytril is one of the most widely used of the fluoroquinolones in veterinary practice. Serofloxacin is now used in poultry for prevention of disease there. So these are certainly an important group of drugs, but one that's come under some scrutiny because of their need for use in humans. Okay, during the next part of this now, I'd like to focus briefly on some of the major classes of drugs that are used for treating, preventing, controlling pain in animals. And these drugs that I'm going to talk about now, unlike the antibiotics, are a rather diverse group of agents that are typically covered in quite different topics when we're dealing with them. But I thought pulling them together here in a single discussion about treatment of pain would be useful for your consideration. Now, drugs that can be used to treat pain in animals, including humans, are commonly called analgesics, and they can act by several mechanisms. Certainly, the most well-recognized mechanism by which analgesics exert their effect can be through the central nervous system, either the brain or the spinal cord or centers in between. But in addition to that mechanism, which I've listed here third, there are two other clear mechanisms by which drugs can interfere with pain sensation in an animal. They can block the actual sensitization of a painful stimulus by sensory nerves at sensory receptors, or they can block the transmission of signals within sensory nerves, carrying that painful signal back to the brain. So there are three clear sites where these drugs can work. And this is somewhat shown here on this diagram, where you can see that agents that act in this area at a sensory receptor to prevent the sensation, the signaling of a painful stimulus, whether that be a mechanical pain, a chemical pain, a thermal-induced pain, regardless of the nature of that, drugs that could somehow interfere with this sensation of pain at the sensory receptor can be an important mechanism. And this is one place where the non-steroidal anti-inflammatory drugs appear to be very effective, as well as secondarily the corticosteroids are also probably acting through prevention of sensing of pain at this location. Local anesthetics are an important group of drugs. These are agents that block transmission within sensory nerves and as a result lead to a blockade of sensing of pain. And finally, the centrally active analgesic agents. The agents in this case I'm going to talk about are the opioid analgesics, the dissociative anesthetics like ketamine, and the alpha-2 adrenergic agonists. All of these drugs act through central mechanisms either in the brain, brainstem, or spinal cord, or possibly all three, to eliminate the transmission of pain and the perception of pain signals within the brain. Okay, now with that backdrop in mind, the five major classes of drugs that are used to treat pain or prevent pain are shown here, as well as their possible location of action. So I've listed here the opioid analgesics as having effects in both the brain and spinal cord, alpha-2 adrenergic agents having effects in the brain, and they also have some indication that they also work in the spinal cord. Ketamine and the dissociative anesthetics certainly have their actions in the brain and higher centers. Local anesthetics can be administered adjacent to peripheral sensory nerves to block pain, or they can be administered at locations such as intrathecally next to the spinal cord, where they can also effectively block pain transmission. And finally, the non-steroidal anti-inflammatories, and in a similar manner, the corticosteroid drugs. These are also agents which can interfere with pain perception at sensory receptors in the periphery. So all of these different sites and mechanisms of action can all be involved in alleviating or preventing the sensation of pain in animals. Now, the opioid analgesics, these are probably the best recognized, widest known group of drugs that are used to treat pain. These drugs work on specific cellular receptors in the body, which I have listed here. There are at least 4 known classes of these that are called mu, delta, kappa, and epsilon receptors. These agents, because their action does involve stimulation of receptors in the body, their actions can be blocked by antagonists, such as naloxone. And naloxone is a widely available opiate antagonist for use in animals. One important point to note about the opiates are that these agents are controlled drugs. That is, they are regulated. Their use, their distribution and handling is regulated by the Drug Enforcement Agency, or the DEA. And in order to use opioid analgesics, in order to be able to prescribe opioid analgesics, you must have a license to do so, as well as you must have appropriate security on your premise for storing these agents and maintaining proper records for your use of these agents to validate your use of them. The opioid analgesics in general can produce a wide variety of symptoms and effects in animals. They are not just purely analgesics, and I've tried to indicate that here. When you think of opioids, you should think of their actions in the central nervous system, as well as the GI tract, as well as the cardiovascular system. The opiates are certainly very effective analgesic agents, but they are also effective at producing nausea in most animals. They unfortunately have the undesirable adverse effect of suppressing breathing or respiration in animals, and that can sometimes lead to death in case of overdosage. They are also noteworthy in that they can produce, as shown here in red, mood changes and sedation. They're generally CNS depressants, so they will sedate animals. The last 2 effects here are listed in red simply because that can be very variable between animals, as I want to point out, between various species of animals, as I'll point out here in a minute. The GI effects of the opiates, in general, you should think of these as being suppressant effects in nearly all species. They tend to reduce motility, reduce secretion, and as a result, these agents can cause constipation, and that indeed is a therapeutic indication for their use. These drugs are sometimes used to treat diarrhea in animals, both small, particularly small animals. Cardiovascular effects of the opiates, in general, these are adverse effects that you do not want to occur, but nevertheless are present in most animals to some degree. In general, the opiates' effects on the cardiovascular system are depressant. So you'll see a decrease in heart rate, decrease in blood pressure, and in some cases this can be quite pronounced, depending on the dose of the particular opioid we're talking about. Now, when you're using the opiates, it's certainly important to keep in mind that the actions of these drugs are can differ to quite a degree among various species. And probably the 2 species that you should be most aware about with regard to this difference in their actions are felines and equines. Cats generally do not show the same degree of analgesic response to the opiates as do many other species, and can easily be intoxicated by these drugs because of their inability to metabolize the opiates very effectively compared to most other species. As a result, the use of opiates in cats generally should be at a much lower level or much lower dosage rate than in most other species. And we're not, at this point, really sure about the effective analgesic properties of these agents at these reduced dosages in felines. And so this is an area of some investigation with the opiates. In horses, opiates, unlike most other species, horses can be moderately to intensely stimulated by the opiate drugs. And as a result, you will often see these agents being used in combination with some other CNS depressant in order to prevent or offset this potential stimulation that can occur. And some of these combinations are listed here on this slide. So some combinations that you'll commonly encounter with the opiates: butorphanol is a widely used opioid analgesic, frequently combined with acepromazine or xylazine, two other classes of CNS depressants that will offset some of the potential stimulant properties of opiates in horses and some other species. Morphine is commonly combined with ketamine. That's a very popular combination in cats. Fentanyl is combined with droperidol, and that's a fairly common combination of agents that's used in wildlife species, free-ranging species. Now, the main precautions for the use of opiates, there can be quite a number of these, but probably the primary precautions are animals that have any sort of respiratory disease, respiratory distress, pulmonary disorder. These agents are contraindicated for use in animals with those problems simply because they can exacerbate it. Likewise, because these agents are able to depress the cardiovascular system to a high degree, an animal that is in shock or severe cardiovascular compromise, it's also contraindicated in those particular cases. Now, there are many opiate agents that are used clinically. Again, these are controlled drugs, so you must have an appropriate DEA license to work with and prescribe these agents. I've listed some of them here, and also separated for you some of the sub-classifications of the opiates that are used to describe these agents. At the top here, the group shown with morphine, fentanyl, carfentanil, butorphine. These are all considered full agonists. That is, these are compounds that are able to activate all classes of opiate receptors and elicit the full spectrum of effects you expect to see with the opiates. The second grouping here, butorphanol, buprenorphine, meperidine, these are sometimes referred to as mixed or partial agonists, or sometimes the term mixed agonist-antagonist is used to describe these agents. These are drugs which are able to mimic some of the effects of morphine, which is the prototype drug for this class, but they are not able to stimulate all classes of opiate receptors fully, and as a result you do not see the full spectrum of effects with agents like butorphanol that you do with other opiates such as meperidine. All of these drugs are, to varying degrees, able to be reversed by the competitive antagonist or blocking drug naloxone, which is used primarily as an antidote for opiate intoxication. So the fact that there is an antagonist available for these drugs makes them very useful, since there's a specific and selective pharmacological way to block their actions. Second group of drugs that are used to treat pain in animals are the alpha-2 adrenergic agonists. These drugs, for which the prototype is xylazine, is the oldest drug within this group, act primarily in the central nervous system and spinal cord. These agents, as their name indicates, are drugs that stimulate alpha-2 adrenergic receptors in the brain and spinal cord. By virtue of that stimulatory effect on these receptors, these drugs are able to produce a wide variety of effects. Typically, these drugs are classified as sedatives, but they are also very effective analgesic agents. They also produce moderate to high degree of muscle relaxation in animals too. So they have quite a spectrum of effects. And the fact that I've classified them here as an analgesic is somewhat different than traditionally how these drugs are classified, because traditionally they're classified as sedative agents, but nevertheless they do produce very profound analgesia. By virtue of their action on alpha-2 adrenergic receptors to produce this myriad of effects, we are able to use specific blocking agents, that antagonists of alpha-2 receptors, in order to reverse the actions of these drugs. And that, again, makes them a beneficial class of agents for controlling pain. Analgesia with these drugs is recognized now as being fairly good in all species. The horse is particularly good in this regard in that these agents produce a very profound somatic analgesia in horses when given an agent like xylazine. The points to note about the alpha-2 adrenergic agents, they are extremely potent in ruminants compared to other species, as much as 10-fold more potent, so you use much lower doses of these drugs in ruminants in general. And in general, too, it is now recognized that the analgesic effect of these drugs does not last as long as the sedative effect of the drugs. So even though an animal is sedated with an agent like xylazine, it may not have a good analgesic effect still maintained throughout that sedation period. So that's an important point to keep in mind about these drugs. The duration of the various effects do differ. Major side effects with these drugs, probably the biggest concern is the cardiovascular depression that can occur. There can be initial cardiovascular stimulation, initial rise in blood pressure might be noted with these agents when first administered, particularly with the intravenous administration, but that quickly reverses into what can become a quite profound cardiovascular depression with a remarkable drop in blood pressure and a remarkable drop in heart rate as a result of that. One species uniqueness about the actions of these drugs is that they are very effective at producing emesis or vomiting in cats, and can be used in that regard sometimes for treatment of accidental poisoning in cats, and they are also a profound respiratory depressant in cats. And that makes them a little bit different, or that's different relative to other species. I've listed here some of the agents that are most widely used within this class, xylazine being the most common older agent and still widely used. There's now some newer agents, ditomidine, medetomidine are two of the newer agents within this class. These agents, by and large, are very similar pharmacologically, though. Their primary difference is in their potency, that is the dose you must use, and the duration of their action differs across these various agents. All of these drugs can, to some degree, be reversed by specific reversal agents, which are characterized by the three listed here: yohimbine, tolazoline, and atipamezole are all very effective alpha-2 adrenergic blocking agents that are able to reduce to some level all of the effects of the alpha-2 agents. The final group of drugs that are used central, at least for central blockade, central nervous system blockade of pain, is ketamine. Ketamine is a dissociative anesthetic. It is used in a variety of species, but it's actually only approved for use in cats and non-human primates. But it is widely used in a number of species now. It produces an excellent somatic analgesia. Its mechanism of action is quite distinct from the opiates and the alpha-2 agonists. This drug now, it's recognized to produce its effects, its analgesic effects, as well as some of its other effects, through blockade of receptors for the excitatory transmitter glutamate in the central nervous system, which leads to its remarkable actions. As a result of this, though, there is no known specific reversal agent for ketamine, so that makes it different from the opiates and the alpha-2 adrenergic agents, for which we have reversal agents. We have no specific reversal agent for ketamine as a drug. Ketamine's actions are quite different compared to many of the other agents that are classified as anesthetics. Remember I said it is a dissociative anesthetic, which happens to have good analgesic effects. Ketamine does not, unlike many other the parenteral or injectable anesthetic agents, ketamine does not produce muscle relaxation. In fact, in many species it causes a rigidity or increase in muscle tone. It is a very potent and effective cardiovascular stimulant, so you see a rise in heart rate and blood pressure in animals that are treated with ketamine, although that may not be outwardly evident to you unless you're monitoring those parameters. Ketamine is, unlike many of the other injectable anesthetics, not recommended for use in dogs, but it is very effective in virtually all other species. Ketamine can lower the seizure threshold and is quite seizurogenic in dogs, and as a result is not commonly used alone in that species. If you do encounter seizures with ketamine in an animal, they are readily reversible by the benzodiazepine drugs such as diazepam or Valium. Can be very effective at reversing those seizures. Okay, the last two groups of drugs are agents that act peripherally. That is, they do not act in the central nervous system, but they act on peripheral pathways which transmit pain sensation back to the central nervous system. First group of these are the local anesthetics. This is a group of drugs which blocks impulse conduction in nerves. Now, they're used as local anesthetics and produce that effect because the nerves that transmit pain signals are small myelinated fibers, which are ones of the most sensitive agents to, or sensitive types of nerves to this particular class of agents. The local anesthetics, though, will block transmission in other types of neurons, including the motor neurons, and can cause a localized paralysis if given a too high injection or directly next to one of those types of nerve cells. So they can be very broadly active. And as an aside, you should probably note also that lidocaine, one of the prototype drugs for the local anesthetics, is in fact very effective use as treatment for certain forms of arrhythmias, cardiovascular arrhythmias. So these agents can interfere with transmission of electrical signals in a variety of excitable cells, not just sensory neurons. So that's an important thing to keep in mind about them. The mechanism by which local anesthetics work is blockade of sodium channels in cells which are needed for propagation of action potentials and transmission of signals along axons. They're applied typically, when given as local anesthetic, they're applied typically locally next to or within the nerve itself and block transmission in that regard. Major adverse effects of the local anesthetics that you need to be concerned with are primarily within the central nervous system and the cardiovascular system. These can be quite severe adverse reactions and can, in fact, if sufficient, can lead to the death of an animal. So they need to be monitored carefully. Within the central nervous system, these agents are excitatory, which can be manifest as muscle twitching, seizures, which can lead to convulsions and death if not properly treated. And in the cardiovascular system, these agents can be quite profound depressants of the cardiovascular system and lead to cardiovascular collapse if, again, given at toxic levels. There's two broad classes of local anesthetics, the ester anesthetics and the amides. These are chemical classifications. The importance of these classifications, the reason for knowing these classifications, though, and which agents belong to them, is outlined here in that the ester anesthetics and the amide anesthetics are eliminated by different mechanisms in the animal's body. The ester anesthetics are broken down by plasma cholinesterases or pseudocholinesterases, and these enzymes are very commonly inhibited by other classes of drugs which are targeted toward the acetylcholinesterase enzyme. As a result, if an animal has already been treated with an anticholinesterase agent, it will markedly interfere with the metabolism and elimination of an ester-type local anesthetic. The amide-type local anesthetics, of which lidocaine and bupivacaine are two widely used agents, these are drugs that are metabolized by the liver and do not rely so heavily on the pseudocholinesterase pathway for elimination. All of the local anesthetics are basic drugs, and the only significance of that in terms of the therapeutic use of them is that because they are basic drugs, they are charged in an acidic environment, and when they are in a charged form, they become less effective. So if you attempt to administer a local anesthetic into inflamed tissue, which is typically much more acidic than normal extracellular tissue, these agents will not penetrate into the nerve as effectively and will not produce local anesthesia as effectively. Here are some of the prototype drugs for this class: lidocaine, mepivacaine, and bupivacaine. And the main differences that are noteworthy about these is really their pharmacokinetics, the speed which they produce their effect, lidocaine and mepivacaine being very fast, bupivacaine being somewhat slower than these, and also their duration of action differs, with bupivacaine being by far a much longer acting agent for the local anesthetics. Final group of drugs that's used for treating or suppressing pain in animals: non-steroidal anti-inflammatory drugs. These are drugs that alleviate pain or prevent the sensation of pain, primarily by blocking the formation of substances that stimulate sensory receptors in the peripheral nervous system. The mechanism by which these drugs work is thought to be primarily related to their ability to inhibit an enzyme or family of enzymes called cyclooxygenases, which is abbreviated COX, C-O-X. There are different forms of cyclooxygenases in the body, COX-1 and COX-2. As many of you are probably well aware, because this has become an important area in the human use of these drugs, there's been much emphasis directed toward developing selective COX-2 inhibitors to try to avoid some of the bad side effects that are associated with these drugs that are thought to derive from inhibition of the COX-1 family of enzymes. This is not as clear-cut, though, as we once thought it was, and for now at least you should recognize that all of these drugs inhibit both the COX-1 and COX-2 enzymes, all of the ones that are used clinically right now. The non-steroidal anti-inflammatory drugs are acidic drugs. They're highly protein-bound, so that's a form of interaction they can have with other types of drugs through the displacement of protein-bound drug. Most of them are hepatically metabolized as a class. They're more toxic in old and young animals, when administering these agents, you must do so at reduced dosages generally in those patients. Major adverse effects of these, primarily the biggest tissue that's affected or organ system that's affected is the GI tract. These agents can produce, with short to intermediate term administration of these agents, can produce ulceration of the GI tract, perforation as a result of the loss of the protective effect of prostaglandins, which are their formation is inhibited after these agents are given. And in this regard, a particularly bad combination of drugs that's noted to really exacerbate or worsen this problem of GI toxicity is the use concurrently of non-steroidal anti-inflammatory drugs with corticosteroids. This greatly enhances their toxicity, GI toxicity. And finally, I've listed here some of the commonly used non-steroidal anti-inflammatory drugs, aspirin, and some of the unique features of it. Aspirin, very toxic to cats. Phenylbutazone is a popular agent in horses. It is a drug, though, that enhances the metabolism of other drugs by liver enzymes, and in some rare cases has been associated to cause or shown to cause a bone marrow toxicity. Acetaminophen is also an agent that's toxic to cats. It's unique, though, or different from many of the other non-steroidal anti-inflammatories in that it does not interfere with platelet function. Ibuprofen and naproxen are noteworthy in that these agents are much more toxic in dogs as far as their GI adverse effects than other species. Flunixin, meglumine, is a very popular and potent analgesic in horses. And carprofen, which is one of the newer entries into this market, is an agent that has been shown to have some hepatotoxicity now in some species, particularly some breeds of dogs where it had originally been considered to be quite a safe agent. So in conclusion, I realize this was quite a whirlwind tour through different classes of drugs, but I think certainly with regard to the basic actions of the antibiotics and the drugs that are used to control pain, it's important to recognize within each class of drugs what their major side effects are and their important mechanisms of action that lead to these effects in animals. I hope that this has been useful to you, and I think as we continue to go through this series, you will see that there is going to be other classes of drugs obviously covered within the various clinical disciplines, and that those will hopefully fill in many of the gaps which I have avoided today because of a time limitation. Thank you very much.